Hello, my name is Erica Scott, and I am a sophomore at the University of North Texas, Dallas for the fall semester 2018. I'm sharing a presentation of my service learning site, which is City Square, for my Human Services Management and Leadership 3000 course, Introduction to Human Services, under the tutelage of Professor Jacks. The City Square Opportunity Center is located at 1610 South Malcolm X Boulevard in Dallas, Texas, 75226. Their mission statement is to fight the causes and effects of poverty through service, advocacy, and friendship. The client population at City Square is the most chronically homeless people in and around the Dallas Metroplex. They have been homeless for over 10 years, 15 years, some up to 20 years, living on the streets of Dallas, Texas. So the City Square Opportunity Center offers them a whole wraparound approach to help them to begin to rebuild their lives. Clients are addressed as neighbors to make it less formal, more intimate, and to continue to build a bond in the helping relationship. Some of the people that are there at City Square are there because of developmental crisis, situational crisis. They've been displaced by natural disasters, Hurricane Katrina, Rita. Some of them are there. They have been faced with financial hardships and developmental crises that have just kind of snowballed and spiraled out of control. The TRACK program, which is a Transition Resource Action Center, targets current and former foster children between the ages of 14 to 24. So the TRACK program does an assessment. It builds on their job skills, vocational training, education, advocacy, how to fill out a resume, how to present yourself at an interview, how to really shop yourself and to build your momentum and to be a productive member of society. That's the TRACK program, because oftentimes when these children turn 18 years old, they're let off into the street with no support system, no financial help, nowhere to live, no food to eat. So the TRACK program helps them with that, and they also offer housing. This is a brief map of City Square. So the Building 100, that's the case management services. They help with housing, financial empowerment, and job training programs. City Square has 20 cottages right across the street from the Opportunity Center where neighbors can live. They can live there for $50 a month. And if they don't have income to pay for that, they will be employed by City Square. City Square has a thrift store. They have different areas in and around the city of Dallas that they could work it to earn the $50 that they need to pay for their monthly rent. They can stay there for up to 2 years. They can have up to 11 violations before they're kicked off the premises. So they do give them an opportunity at the Opportunity Center. Building 200, which is over there, that's the AmeriCorps Workforce Solutions, excuse me, and the Boardroom and Operations. Building 300, that's the Health and Wellness Center. MetroCare is there. Chronically ill are served there. People that have diabetes, cardiovascular disease, those that are suffering with AIDS or HIV positive. MetroCare comes twice a week to administer services, medicine, and counseling at the health center. The last building is the Building 350, and that's where the cafe is, the food pantry, and also hospitality program. The hospitality program is a 6-week TABC course. That's one of them. So once they complete their certification, they can work in nightclubs, bars, restaurants, serving drinks, alcoholic beverages, or being a bar back. The 10-week hospitality program, that's for the food services, food prep. They could also be an apprentice in a kitchen to help their chefs. So those are different programs that are offered at the City Square Opportunity Center. How City Square serves on the macro level. They give the neighbors a powerful voice to advocate for themselves, to engage and influence policy change on a local level, city level, state and federal levels. They teach them how to ask for the things that they need. On the meso level of service, The neighbors grow and advance from the job training, from the opportunities that they are afforded. And a lot of the times, local businesses, small businesses within the community hire them to work for them once they complete their certification. And most of the people that complete the courses, which is in construction, carpentry, plumbing, welding, they continue to grow in their field. The micro level of service, that's the client and worker relationship. The clients or neighbors are placed with the same caseworker. They do not switch caseworkers throughout the course of the services at the city square, because that person is familiar with them. They're familiar with the caseworker. They become more comfortable in talking to them, sharing their problems, their desires, their needs, and the caseworker, once they get to know them, they can assess them better. So they continue to follow them from the time they walk in the door to the time they walk out of the door. Because most of the time, people that come there, they don't just have one problem. They have a list of problems that they need addressed. So that's where the caseworkers come in at, and the different volunteers that serve at City Square. The strengths of City Square that I noticed, the volunteers are trained properly and the clients are treated fairly. As I said, they don't even refer to them as clients or recipients. They're referred to as neighbors, because they want them to feel comfortable. They want them to feel like they're in a safe place, a comfortable place to ask for the things that they need and to flourish and grow. The City Square, they're a one-stop shop, as I mentioned. They have an opportunity center, the health center, the financial empowerment, the food pantry, the housing, the cottages. I'm going to share a little bit of the neighbor impact that City Square accomplished in the year of 2017. They serviced over 40,000 neighbors in the year of 2017. 93% of the ex-offenders that went through the certification programs, whether it was TABC or the hospitality services, they did not reoffend, and they still hold those jobs. The City Square AmeriCorps, they helped to place 293 people at 19 nonprofits across the DFW Metroplex. With the City Square Food Pantry, distributed over 2 million pounds of food to 13,805 individuals in 2017. So they are making an impact in the community that they serve and across the whole city of Dallas. They're one of the top nonprofit organizations in North Texas. The improvements that I noticed, it was kind of hard to differentiate between the neighbors and some of the employees and volunteers, because it's such a casual atmosphere. They had on t-shirts, tennis shoes, jeans. The neighbors and the workers, even the administrative staff, all of them looked alike. So that was kind of hard to differentiate, because they didn't wear badges either. On 2 separate occasions, I witnessed a fight, an altercation between neighbors. The first fight was at a free phone that they have in a public community area that they are allowed to use. I think one of them was on the phone for too long and a fight disrupted. Then the second time was when they were allocating free shoes and clothing, another fight started. I didn't notice a security guard. The workers, the human service workers, they had to break up the fight, send the people to different corners, and just try to keep them apart. So I think a security presence would be necessary. That's one of the main areas of improvement. So City Square incorporates all of the models. The medical model, because the on-site health clinic provides a full range of medical services, as I said, from chronic health issues to medicine and all of that disbursement. They have primary care physicians there. Metro Care comes twice a week for mental health services. They also offer transportation to Methodist and Parkland hospitals, because that's where they will go get their imaging done and to see specialists. The public health model, City Square has an entire initiative to fight hunger, to fight health disparities, and to fight homelessness. They are teaching people to advocate for themselves. They're encouraging them to practice better eating habits, to further their education, and for drug prevention for those that are battling drug use. The human service model, they incorporate that with the closeness and the wraparound approach of the helpers. They have a very tight-knit relationship with them. I mean, I didn't see any type of animosity from the workers. They didn't act like there was one time that they didn't want to help. They were always there during the regular hours, and after hours they were available. So that's the human services model that I noticed, and they help the clients to just become stronger and self-sufficient and learn how to advocate for themselves. In conclusion, I gained such a respect for the entire helping process through my service learning hours at City Square. The things that I saw, the testimonials that I heard, the achievements from the neighbors, the hard work that they put in and that I saw, just galvanized me to just do more, to be better, to be more present in and around my community. So that's what I learned from my service learning hours at City Square. I networked with some phenomenal agencies. I built some great relationships with some of the other agencies that are there to donate their time and services and money. I was taught different ways to serve and volunteer besides philanthropically. So you don't always have to give money. You can give your time. You can gather up your neighbors, your family to serve, because there's always a need for service. It's not just for the holidays. It's not just for Christmas, not just for Thanksgiving. It's 365 days a year, 24 hours a day that someone is in need. So as I expressed with Professor Jacks and also my supervisor, Mamie Murray at City Square, that I intend on continuing to serve and volunteer my time. Left quite an impact on me. The sources that I use is, of course, if you want to learn more information about City Square, or if you'd like to serve yourself or donate, you can visit www.citysquare.org. I also borrowed inspiration from my textbook, An Introduction to Human Services by Woodside and McClam, 2017. So this is the end of my presentation. I appreciate you for coming to visit. Thank you, and happy holidays.